Welcome to Politics Done Right. I'm Egberto Willis, your host. We are going to have a great show for you today. Please remember, this is your show. If you're driving into work this morning, if you are just getting up and getting that first cup of coffee, welcome aboard, folks. This is a call in show 713-526-5738. Again, that number is 713-526-5738. Extension number 1 to contribute, extension number 2 to be on air. If you have something to say, please don't wait till the end of the show to call in because we get limited time and I kind of have to hurry you off. But we don't want to do that. We want to hear your point of view. We want to hear your voices because once again, this is your show. Good morning, Howard Reynolds. Good morning, El Senor Jacques Van Bieber. How you guys doing out there in the studio?
Oh, we're upright.
Yeah, we're doing all right, Egberto.
So
You're
far, the 10
upright.
chickens and string are holding together.
You know, this morning it held together like no other. You just came in and pushed a button and it was all there. And I know it's like, at least we know the strings are not popping. Anyhow, folks, we're going to have a great show for you today. The title of the show today is A Real Healthcare for All Story. Healthcare for all is the only answer. Leave TikTok alone. All of you Houstonians, all of you from the Houston metropolitan area and all over, we haven't yet done what Montana has done to ban TikTok in their state. You know what? It's funny because I'll go into this later, but you can't really ban TikTok. The truth of the matter is, folks just have to do some machinations with IP and VPNs, and they'll work just fine. The fix is already in. What those people who want to control your lives have to realize is that there's always a workaround. There's always a workaround. You know, a few days ago, somebody was talking about how people do things, and I'm like, laws are laws, but if a law makes the lives too difficult for people to abide by the laws, in the long run, they always find a way around the law. That's just human nature. We do what we need to do to survive. 713-526-5738. Extension number 1 to support us. Extension number 2 to be a part of our show by calling in and talking. So again, remember, please, this is your show, and we do want to hear from you. The first part of the show is an interview that I did with Vic Uzumeri. Vic Uzumeri is an engineer. Vic Uzumeri is a citizen of the United States as well as a citizen of Canada. And what he did is after he retired, he went back to Canada. And the major reason for going back to Canada was healthcare. When he was here, he was on the healthcare system from the job that he had. But and so he was one of the lucky few in the United States that had very good coverage here in the United States because of the major employer that he worked for. But he has a story to tell. I recorded this at Netroots in Pittsburgh a few months ago. And given that we just got Medicare for All again reintroduced into Congress a couple of days ago, I thought it was apropos to let folks hear this because not everybody heard it when I did it, but most importantly, because of the bombardment of misinformation, the bombardment of lies that come from the medical industrial complex that try to let people believe that having things like a single payer system or having everybody insured. You saw the piece that I did with the great work from Channel 13 a few days ago, where we had somebody say that we cannot give Texans health care because it would overwhelm the system. I want you guys to understand the inhumanity in these statements that we hear out of our Texas legislature. We will just let some people die because, there may not be enough doctors, or we'll just send too many people to the doctor if we give everybody health care. It's not that we can't give people health care, it's that we choose not to give people health care. It's not that health care costs too much, it's that we choose to create a system in which health care is nothing more than a monopoly. Later on, I'm going to talk to you as well about what's occurring here in Houston. We're a major investment company that bought up some healthcare companies because they thought they were going to make 10 times their investment on that income, finally went bankrupt when, even as they were gouging people, they just realized how difficult this thing is to make money off of illness when there's a population not very well insured. But without further ado, well, let me just say before I start that interview, I want to ask you. You can do all of this while you're listening. You can go to kpft.org and support Politics Done Right for KPFT. Support KPFT via Politics Done Right. Go to kpft.org, hit the donate button, and contribute whatever you can. Real quickly, $40 contribution gives you complete access to vote in both the local station and the National Pacifica Network, which controls hundreds of stations and 5 major flagship stations. You can also provide a $100 donation for a Politics Done Right t-shirt with the logo of KPFT on it as well. And you can, if you donate $250 or above, I'll take you to coffee and we'll sit down and we'll talk politics or whatever you want to talk about. And I think if Howard has the information right now, there's a $75 bus tour of the Houston area. Do you have that with you, Howard?
I do. It's posted right here on the wall. And why more people don't talk about this, I don't know, because this is really cool. Our very own Mr. McKinney, who does the Houston Hour, tonight, as a matter of fact, from 6 until 7, he has volunteered his tour bus. It's an open air school bus for an hour and a half pass to the VIP tour of the Houston's historic places. Herman Park will be one of them, Museum District, Texas Medical Center, and a tour of the radio station, which is really cool. $75 gets you in. It's a pass good for 1 year. So they're going to be doing this once a month tours, which is really pretty cool. So contact us at 713-526-5738. Pick up a couple of passes. That would be a kind of a first cool, a cool first date or something. If you got the lady that you really want to impress, well, Mr. McKinney's very impressive, and so is this tour. So check us out. 713-526-5738, extension number 1.
Thank you so kindly, Howard. So again, you can call 713-526-5738 to give whatever you can, whatever you want. Remember, this doesn't have to be paid all at once. You can pay it in installments over the months. Likewise, if you go to kpft.org, please do remember to when you donate, to select the Politics Done Right program as a program that you are supporting. We must raise $250 per day. Have not made that all week to support the program. Please be so kind to ensure that we can stay on air by making sure it's known that Politics Done Right is a supported show by the public. Let's go ahead and get started with the interview, and we'll talk about it after that. Please be prepared to call in if you want to discuss this subject before we go to the other subject. Remember, this is your show. You control what goes on. Here we go. Welcome to our first edition of Politics Done Right outside of Netroots, or rather in the Netroots Nation Conference here in Pittsburgh, Pennsylvania. And as our first guest today, we have Vic
Usamary.
Vic Usamary. I noticed I paused because I wanted to make sure to get Usamary correctly. Vic, welcome to Politics Done Right.
Thank you, Edberto.
Hey, Vic, we're here trying to unite folks here in the progressive domain and learn about different policies, etc. And one of the things that I've been very interested in is healthcare. Mm-hmm. Now, you are, I call you an expert because you've lived in both systems. You've lived in the American healthcare system and you've lived the Canadian healthcare system. First of all, just an absolute term, which is the better system?
Like every business system, and
Right.
I'd characterize these as business systems. I mean,
Right.
we tend to put magic in there. It's magical healthcare, medicine, Ouija board, and all kinds of
Right.
stuff. They really are trying to systematically deliver healthcare services to the population. So, in U.S. has one system. Canada has another system. There are probably 30 other
Right.
systems.
NHS in Great Britain.
Well, the OECD countries. There's 32 countries and 32 different variety
Right.
flavors of the system.
Right.
So it's a system. So my background is I taught business operations management, supply chain for a long time, decades. And business systems you never take a business system against another business system and say one is better. You can't. Parts of one are much better than another, and it'll flip the other way. Now, some cases, a lot more parts may be good in one system than are good in another, in which case you form a strong appreciation for the system you think has more good parts.
No, I want to.
And Canada is the one I would say has more, on balance, has more good, well thought out pieces of the puzzle than the United States
You're
does.
a very diplomatic person, is what I will say, because I look as both of us are engineers, but as a more, I guess, absolute engineer, I would look and I look at outcomes, and if you look at the outcomes from one system over the other in the aggregate, just about every single system in the OECD comes out
Outperforms the United
ahead of
States.
the United States.
Yes.
And I think in my opinion, that's the answer that we look for.
I agree. I mean, if you ask me which would I personally prefer to live with, the answer would be the Canadian system.
Now, you told me a story that kind of boggled my mind. And first of all, we're going to sort of touch on your wife's story, as it relates to healthcare. But you mentioned something that, to me, when I heard it, I just didn't think about it. You said when you go to a doctor or you seek healthcare in Canada, money never comes up as a topic.
That's correct. The closest, let's see if I can fish it out. The closest it comes is
It's
this
a card.
I mean, this might as well, for all intents and purposes, might as well be a Visa or MasterCard.
Right.
I mean, it does exactly the same thing.
So whenever you need healthcare,
You go into a bar, you talk to the bartender, you get your drink, you have your meal, you chat with your friends, you chat with the bartender, they give you service, do all that stuff. The only money you talk to a bartender is when they bring you the bill and you hand them your Visa card.
Right.
Okay, think that experience, and that's the Canadian
So
experience.
they give you healthcare and you provide that as the
You up front, you walk in, and they need to know who you are. That's your ID card.
that's your ID.
So, and at least where I am, downtown Toronto, all of my records are electronic.
Right.
So when my family practitioner sends me for a test, I go to get the test. I show my card. Well, that card allows them to look up my medical records before the test.
Right.
I mean, all that stuff is organized. It's all tied around. And the key is that it's a single point of truth
Right.
about who I am and where the money's coming from.
Exactly.
And there's a big concept in business about when you build business systems is establishing a single point of truth. That is one place you can always go reliably to and get the facts. And everybody can do it, so everybody can be on the same page.
Unlike our system where one particular doctor, any patient comes in, he has to have a staff to tell him exactly what insurance company are you with and call them up, see what's covered. That's
right.
That
to me is the fundamental flaw
inefficiency.
and inefficiency in the U.S. system. U.S. system spends 25 to 35% of its healthcare dollar
On administration.
not administration, trying to figure out who to stick the bill to.
Right.
I mean, it's not about paying the bill. It's not about delivering a service. There's nothing in there other than, everybody's scurrying around like rats
Right.
in a maze trying to figure out who's going to be the unlucky soul that gets stuck with a bill. That's the whole, that's almost quarter to a third of the total healthcare expenditure in the United States. Canada does not have that
Right.
at all.
Right.
All right, so right there is any medical service you want to provide in Canada. You know, there's minor stuff around the edges, but in theory, it's going to be 25 to 30% cheaper.
Right.
Just because that cost is not part of the equation at all.
That is him. So tell us a little bit about your recent experience that probably would have bankrupted somebody here in the United States, and you had it in Canada.
Well, we just moved. My wife and I just moved from Atlanta. I mean, my background is I spent 20 years teaching at Auburn University. Then I took early retirement and lived for the past decade in Atlanta, downtown Atlanta. And then last August, we sold our condo and moved to Toronto. And
Right.
both my wife and I are Canadian citizens, natives. We were born there. So we were able to move back.
Were you American citizens too, or
Yes,
resident? Yeah.
we're dual
Okay.
because over 35 years in the United States, I'd become naturalized.
Right.
But you don't throw away, don't change where you're born. So
Right.
I'm still a Canadian citizen.
Right.
So I was able to move back pretty seamlessly. And to get health care, to get that little card, the only really bureaucratic thing I had to do is we had to have a permanent place to live because it's based on where you're
Your
resident.
residence, right?
Yeah,
Each
like-
province have its
Each one
instantiation,
has
right.
it, and plus all the paperwork has to go somewhere. They have to have a place to mail you and so on. So it wasn't even when we moved into an apartment. It's when I had the signed lease from the apartment.
Right.
I was able to go down to Service Ontario, the government office with one-stop shopping, show them the signed lease, and they handed me, the equivalent of a temporary driver's license. They
Right.
handed me a sheet of paper, which was my temporary health card, had
Right.
the code that mattered.
Right.
Card didn't matter, the code did. And 2 weeks later, the plastic card
Right.
showed up in my mailbox. That's it.
And now you are a covered citizen.
I was covered from the moment I got that piece of paper with my code number on it.
Right.
The temp.
And then you can go get health care.
I can walk into any. They have a system there. Basically, it's all run through. Now, in the U.S., my wife and I were first in downtown Atlanta. We were in the Emory healthcare system. I had U.S. pensions and have very good, Medicare Part A,
Right.
B, C, D, and supplemental from the last one was Humana. I mean, we were well covered
Right.
in the States, and I was in the Emory system and then in the Piedmont system in downtown Atlanta. And within those systems, we could sort of get anything we
Right.
wanted. With that card, with the Ontario card, I can walk. I go to my family practice. They assign you. You have to have a family practice. You have to have a quarterback. So the first thing you do when you get the card, or even when you get the code number, is phone a
Exchange or
exchange, and they take your information and say, okay, and then they go look for a family
Right.
practitioner, and they say very clearly up front, if you don't like them, just call back and we'll get you another.
Right.
I mean, it's not like we're sticking them, but here's one we think, the one we have right now is a 5-minute walk.
Right.
They had that criteria, and so my wife and I each have our own family practice,
Right.
and everything goes through them.
Right.
And they can, anything I need in the way of services or diagnostics or testing or anything like that, if it makes medical sense, then
Right.
he just writes a referral and boom, it's done.
Right.
When I go to get the test, I just show my card,
Right.
they knock it off. There's never a conversation about money.
Right.
There's never a conversation about bureaucracy.
Right.
The only bureaucracy I've encountered in the Canadian system is bureaucracy if it had a specific medical meaning
Right.
and requirement. It was
Exactly. I get exactly what you're talking about. You know, there's a reason for that bureaucracy.
When you're arguing over, when you're talking about when will I get another appointment, the
Right.
other appointment is, well, when will it make medical sense
Right.
for you to come back? No point coming back in 2 days. Nothing will have changed.
Right.
So to go from the Emory and the Piedmont system, which are very sophisticated systems.
Right.
I mean, those are probably right at the top of U.S. medicine.
Right.
Business practices.
Right.
To Canada, and it's just so clean and simple.
Right.
And because it's all through the same system, my records are available to everybody I go to. I don't have to
You
make.
don't have to fill out a whole
They
list.
already have them.
Of things. Efficiency.
If they've got my code, they've got the access, and they already have.
I tell you something that they use in the United States to dissuade people from doing things like that, right? They like to use this thing called privacy, not realizing, that's in having your records centralized like that is.
Well, you got a trade-off. You got a trade-off.
Right.
You can hide your medical condition from your doctors,
Right.
and you can be confident that they will not know
Right.
what you've had and where you've had it and what's
Right.
happened. And then they can make a mistake and kill you.
And that's what people don't understand. But the other thing that they talk about with privacy is that, well, if everybody has your records, they can actually see it. And to my thing is, the only reason to hide your medical records in the United States system is to sort of con the system so that they don't know, some entity doesn't find out that you had something before.
Yeah, if you're running
pre-existing condition.
a really good Social Security scam,
Right.
then that kind of privacy makes a hell of a lot of sense. I'd be all for it.
Exactly.
I mean, every Social Security scammer. I mean, but that's when I say business systems. You got the same business system issues in
Right.
every other business system.
Exactly.
But did the supplier really put stuff in the container before they shipped it, or did it drop
in the ocean? Anyway, Vic, I want to before we close here, I want to go over that story about your wife.
Okay.
So let's go ahead and talk about something happened recently. Just tell us that sequence.
Yeah, this is after we arrived in Canada, and my wife, my wife went to her family practice,
Right.
and said she was told she really needed to have. It was time to have some diagnosis. There were some signs and stuff like that. Family practice doctor pushed her to go get the diagnostics, and set everything up. It was all done. I mean, boom, 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 boom. She went, got the diagnostics. They found an issue. It was going to require some fairly serious surgery. The next step is the lab that found the surgery. The doctor at the lab that found the surgery had already went straight ahead and made a referral. And where we are, we're very fortunate. There are 5 major research teaching hospitals within a 5-minute drive.
Wow.
So, I mean, they just went around all these great hospitals and said, okay, who's got an opening? Oh, okay, over there. My wife went there. Turns out the doctor is probably top 20, top 50 in North America.
Wow.
Young guy, I mean, 40s, sharp as a tack, really nice. And his performance was absolutely professional. I mean, as good as you. Emory and Piedmont would die and go to heaven if they could deliver that service.
Right. And you got some of the best insurance here in the United States, and it turns out that this that's going to cost you nothing.
Well, as I said,
other than your taxes.
Piedmont or Emory, on their best day would have equaled what we got.
Imagine that.
She went into hospital. She had surgery. Actually, before that, he wanted to be certain of the diagnosis. So she had full blood workup, ultrasound, MRI, CAT scan, everything. Boom. It took him about 2 weeks to get it all scheduled. He looked at everything, took it to a team in one of the hospitals where they actually review these cases as a group. And, so they get input from multiple eyes on the problem. Came up with a plan, involved surgery, booked her into into a hospital. She went in. She had the surgery. She stayed 3 days. Went home. She got 10 visits from a home support nurse, RN.
Just a follow up.
Make sure that follow up after the surgery was going well, there was no infection, yada, yada, yada. And she has regular appointments with a follow-up nurse at the hospital every couple of months now, scheduled out for life. As long as she wants them, as long as she needs them, she can have them. She can just go there. Total cost,
Zero.
out of pocket.
And
No, sorry, it's not total cost, a lot more. Out of pocket to us,
Zero.
Zero.
But the truth, and then one of the things that I asked you, and we're coming close to the time that we have to close, but one of the things that I asked you was, hey Vic, but aren't your taxes a hell of a lot more than in the United States? And your answer was a bit surprising.
Well, it's hard to tell, but it's not hugely different. I mean, because first of all, the moment we came to Canada, I was able to drop the Medicare Part B and the Humana Extended
of that,
Health that I
right.
was doing through my pension plan. So right there is about $500 US a month.
A month that you don't pay at all.
Then I don't pay it all. Gone.
Gone.
Now, are my taxes higher than that? Because of my situation, it's actually a little high. I had some business losses in a previous year. And
Right.
They carry in the States, they don't apply in Canada. So I'll probably know next year. My sense is I'll pay a little more in Canada,
Right.
but
For what it's worth.
not remotely. It won't be egregious in any way.
Right.
And the net effect is, but the peace of mind.
The peace of mind, and you know that you can get the service when you want the service. So the fallacy that you have to wait. I tell people here in the United States, try to make an appointment with a specialist. Here in the U.S., sometimes you're months away from being able to see a specialist.
Well, you'll be months away from seeing a specialist if it's an elective situation in Canada. I mean,
right.
Specialists for elective surgery are scarce everywhere in the world.
Right.
So you're going to get that. And, your mileage may vary. I mean, my mother had a hip replacement and they made her wait 6 months. 4 or 5 of those months she was doing rehab.
Right.
Now, either that rehab was to,
See if she really needed it after all.
was either to sort of a sneaky way of rationing the care,
Right.
or it was just damn good medicine.
Exactly.
And I don't know which one it is. I'm not going to say.
Right.
Overall, my sense is financially on the medical side, we're going to be close to a wash or somewhere reasonable. And it allows the system that's been built, which has its weaknesses. I mean,
Right.
there's some areas that Canadians bitch about their healthcare system.
Right. Everybody.
Well, the only thing is when they do survey, if you do a survey of Canadians and say, are you satisfied with healthcare? They'll say no. If you ask them another question, would you trade your healthcare for the U.S.? The answer is hell no, no.
And I think that is where we ended. Vic, thank you so kindly for being
Take
a
care.
part of Politics and Right.
Enjoyed it.
Well, folks, that is reality. That isn't coming from the media. That isn't coming from the liars, from the corporate structure. That is coming from somebody's lived experience in Canada. And I could repeat that lived experience over and over and over again. Before I go to Mr. Gonzalez, I want to, or I don't know if it's a Mr. or not, to Gonzalez, I'd like to ask everyone to give us a call at 713-526-5738 to contribute. Hit option number 1 to contribute. Remember that to select Politics Done Right as a program you're supporting, or go to kpft.org. Go to kpft.org and click the donate button to support our program. The only way we remained on air with a particular program is for that program to show that people want to hear that program. So I ask you so kindly to call 713-526-5738 during this fund drive. In fact, do it now if you can. Hit the click on donate button and you can support the program. I forgot to mention 2 other options, and that is the BRIC, which if for those who give $25 a month, there's a brick with whatever insignia they want, including their name, etc., that we'll put on our path. Likewise, for $50 a month, we also give you an 8x8 brick that you can place anywhere. So there are a lot of ways to support us, from the least expensive to the most expensive, but we do need your support. This show needs $250 per day, and we're about 4 days behind. Please go ahead and provide whatever you can at however you can. Anyway, let's go ahead and go to Mr. Gonzalez, or Gonzalez. Gonzalez, how are you doing?
Good. My name is Gonzalo.
Oh, Gonzalo, ¿cómo estás, hermano? Bienvenido a Politics Done Right.
Bien. Mucho gusto hablar contigo, y I'm very. I follow you since I work in a school. I'm a teacher, and I also have to deal with crop insurance here in the U.S. I'm a dual citizen. I'm also Canadian, and I have a Canadian experience in Quebec. So maybe I agree with your
Vic.
in some points. I disagree with him in some, but all in all, I think it's the truth. I mean, if you just put the two systems in a balance, of course, the Canadian is a lot better. I would say that Canada, I don't know if you know a little bit about the history of the Canadian system.
I actually remember how it was formed. It was one of the poorest country and one of the worst systems in the planet for a while.
Yeah, I mean, if you know Terry Fox story, it was a guy, 16 years old kid that got cancer, and he ran a marathon. His goal was to get from West Coast to East Coast. Unfortunately, he couldn't make it, but it was a very shocking story for all Canadians, and I think that was the beginning. I think it was Trudeau. I'm not sure about all the things that I'm saying, but what I'm saying is that Canada is the second largest country in the world, but with a little population. And
right.
In the 70s, the Canadian economy was probably so strong that they decided to purchase all the major hospitals, something that could be impossible here in the United States. So that's the reality, and that's the system that we have to deal with here in the United States. Canada could afford that, the government at that time, and I think it was a very wise and novel idea, and I think that's the beginning. Of course, the system is not perfect. Your guest told us about it. I could just tell you some of my experience in the Quebec system, and also highlight some things that probably do not happen in Quebec when you arrive as a coming back citizen. As far as I know, and that has not been my case because I moved 10 years ago to Houston, but I have friends who were born in Canada, and they have to wait 6 months because they were overseas for more than 6 months and more than a year. And I think when they come back, if they want to get the services, there is a waiting time, as far as I know.
Well,
Quebec.
Vic's experience is from from a year and a half ago. So maybe things have changed. I don't know, but Vic's, yeah.
And I talking with friends that are there, and of course after the pandemic, the shortage in people working, nurses, doctors, etc. They have been forced to do things to mitigate that lack of
shortage.
Of course, for example, you have to wait long lines, and that happened prior to the pandemic too. In my own experience, I can tell you I had a nose surgery with an excellent doctor. He was a plastic surgeon from Mexican origin, he was about to retire, but I was, a rock star. And the first time I went to the surgery, I was ready since early in the morning. And at 3 o'clock, he came very kindly and he told me, Gonzalo, you have, unfortunately, I cannot operate you on because I only have one nurse, but I promise you next time you will be the first in line. So I was frustrated. Of course, I worked in school too. I had the benefit of having my 8 days or 9 days. I don't remember. But I'm telling you, the next time he put me, I was the first in the surgery room, and it was a successful experience. You also have to deal with the private because as your guest told us, specialists and some particular procedures can be delayed because of
Right.
many factors.
Right.
You have the option of the private, and actually, my plastic surgeon, I don't remember his name, he had a very luxurious office in Sherbrooke Street, downtown Montreal, but he worked for both. And I think that's the reality, actually. In order to make the system work, you have to deal with both. Because the Canadian public system is not perfect. And I have told you that at the beginning, and I can tell you that, of course, it's better than this system, and I gave you the historical reasons why it's better than this one. They could afford at some point to buy those hospitals,
Right.
but they coexist both private and public. And of
And-
course, the public and the benefit, it goes to the burden of the citizens and the people who work, because Canada, of course, pay higher taxes. And as your guests also say, when you come back, probably you have a business, you're going to see the difference. You're not making that much money, but you have peace of mind that probably you will have a better opportunity to survive after dealing with all the bureaucracy and all the things that you have to deal here with.
And you know, Gonzalo, I think what you just gave was a frank discussion of different healthcare systems, and what you said makes a lot of sense. Of course, whenever the government and any entity tries to optimize its use, so things like hip surgeries and so forth, you don't want to. You want to have as little slack in that system as possible, right? So therefore, you schedule people, and if the lag time goes over 6 months, maybe then you start hiring more doctors so that the lag time gets reduced, but you increase efficiency so that it's always used. As an example, if you go to any diagnostic center around Houston, you will see that most of the very expensive equipment, they're not being used for most of the times. And while they're not being used, that means that capital investment, we're all paying for several capital investments that go unused. So, I mean, the way you are so correct when you say no system is perfect, and that's true. Unless you had unlimited monies, no system is perfect. And what the Canadians have done is taken out the huge majority of profits. Now, I want to do a slight pushback on what you had to say about buying hospitals, and because Canada was smaller and have less hospitals to purchase or whatever. I was never talking about, whenever I talk about healthcare for all, etc., about the necessity of us to make hospitals public. I'd like to have a hell of a lot more public hospitals, but that isn't to deny private hospitals. But what it does is it prevents you from paying $100 for aspirin, $100 for gauze, and these things when there is a competitive.
That's absolutely insane.
Right.
I said for a family insurance, $700 per month, and I had a a problem in my shoulder, and of course it's not a big deal, and I have to wait to see if it gets better, because if I go to my family doctor, I have to meet the deductible, and I have to pay $150 just for the doctor to tell me, okay, get an aspirin or get this, or we have to do
Exactly.
a procedure or an X-ray. That's insane, you know. And let me tell you something. I moved from HISD. I'm not going to tell you where I am now, but all the insurances and all the public system are like the one that I have now. And
Right.
HISD, you know, the story behind had a very good insurance. I hope with the changes and the TEA taking over, they are not going to take that away from teachers, because again, that was a big difference. I'm telling you.
Well, let me tell you what my answer to that is, Mr. Gonzalo, and that is we have to realize that that we can actually force the type of healthcare system, just like like Canada made the decision. They just had to choose humanity over maximal profits. Humanity over maximal profits. I have nothing against profits, but what we have in the United States isn't profits. What we have is profits on people being killed. And when we start to look at things for how they really are, I think changes can be made. Señor Gonzalo, muchísimas gracias por la llamada. Thank you so kindly for
Muchas
giving us a...
gracias.
Ok, tenga buen día. Hablamos más tarde. ¿Está bien?
Igual. Take care.
Thank you, sir. Anyway, that was Mr. Gonzalo. Thank you very much for that call, folks. I need to stress very, very much that we need to raise funds for our station, KPFT. I have two other subjects to cover today. I wanted to bring an objective view of one system that's out there that's orders of magnitude better than ours, from an actual Canadian who has lived in both systems. You are bombarded with information continuously. You're denied truths. You're given lies by people whose interest is there by the chaos in our system. With the chaos in our system, they can profit and profit and profit at your expense. I wrote a piece a couple days ago where I showed that the actual number of deaths in Texas and around the country for the 10 states that do not accept the Medicaid expansion to the Affordable Care Act is over 2,500 people dead every year. And that from the party who believes they are the party that believes in the sanctity of life. Monies are there. For ideological reasons, they're denying it. If we decided to have true universal health care via what we call Medicare for all, healthcare for all, or whatever you want to call it, so many more people could live. So many more people could be more productive. Our economy could take off. It just means that the evil few wouldn't be able to collect on all that they collect on right now. So I ask you so kindly, support the station that's bringing you real and true information. 713-526-5738, extension number 1 to contribute to the show, extension number 2 to be on air. I also ask you so kindly to go to kpft.org, kpft.org, and and you support us by hitting the donate button. And you can then select what you want as a gift or how much you want to give. Please be sure to select Politics Done Right as a program to support. Let's go ahead and bring in my sister, Alistair Water. Come on in, Alistair.
Hey, brother. So I just want to say something about, how Texas in particular won't sign on for the Medicaid expansion.
Yes, ma'am.
Most people that I know don't like to pay for something that isn't being used.
True.
And we are paying in Texas. We are paying as a state. And it's not being used.
I am so glad that you said that.
humanity, I mean, not that any one particular person, if you have, health care coverage and whatnot, then of course you're not going to need the Medicaid expansion. But there are families out there that do, that can't get it. And I know humanity wise, we are good people. And why would we want to pay for something that isn't being used?
That is so true, and that is fiscally irresponsible. So here we have a party in Austin that claims two things that proves and that they do the opposite. They say they are fiscally responsible, and they say they believe in sanctity of life. Yet they are allowing Texans to pay a hell of a lot of taxes for the Medicaid expansion to the Affordable Care Act, not use the Medicaid expansion to the Affordable Care Act, and the fact that they're not using the Medicaid to the expansion of the Affordable Care Act means more Texans die. So everything they say they're about, it's a lie.
Absolutely. And, how people would tote that, Republicans are all about small government, smaller oversight and whatnot. Well, we haven't been seeing that example in a long time.
Well, as we can see, the new Republican legislature or government throughout the country, they want to be in a woman's womb. They want to tell her what she can do. They want to tell you what books you can read, what books needs to be removed. They don't want it to be. They claim they want the choice of. Yeah, they claim they want parents to have choices, yet they don't want certain things taught. I mean, I call it the largest form of projection possible. The problem is in the process, people get hurt.
Yeah, that's the sad part, because those numbers are people.
Exactly.
Those are actual people and actual families affected.
Exactly. Alistair, you're hitting the nail on the head. Anyway, my dear, anything else you want to say real quickly so we can go ahead and go to the next subject?
No, I'm all good. Thank you, brother.
Thank you, sis. You have a great day. All right, my friend. All right. Here's the deal. The second part, first of all, I want to ask you again, please call 713-526-5738. Hit option 1 to support the program, option 2 to come on the program to speak, or you can go to kpft.org. When you go to kpft.org, hit the donate button and please contribute whatever you can. A t-shirt, $100 with our logo and both the Politics and Right logo and the KPFT logo on it. You can do from a $25 subscription to a $25 donation to be a voting member, Pacifica, $40 to be a complete voter in Pacifica. Or you can go to a $250 contribution. I'll take you to coffee. We can sit down and have a whole lot of chats, etc., etc., etc. But we need your support. Politics Done Right is way behind on the quota that it has to raise. 713-526-5738. Extension number 1 to contribute. Extension number 2 to be on air. If you want to say something on air, please do so now. We only have about 8 minutes or so left. Anyway, want to let you know. The evidence is clear. This was from an article that came out in yesterday, actually, the 18th. Came out yesterday, and it says, the evidence is clear, Medicare for All will save money and lives. The only 2 peer-reviewed medical articles on the issue in the last 30 years came to the same conclusion. Medicare for All will save money by removing unnecessary paperwork and insurance company profits, lowering drug costs, and other factors. On Wednesday, Medicare for All legislation was introduced in the United States Senate and House by Senator Bernie Sanders and Congresswoman Pramila Jayapal. The bills use public financing to provide excellent insurance, including dental, vision, and long-term care for everyone with minimal cost sharing. A central question is affordability. Will Medicare for all raise or lower healthcare costs in the United States? Is it affordable? We led two academic teams that published scientific papers to address this, the only peer-reviewed medical articles on this topic in the last 30 years. We worked separately at Yale and the University of California. We came to the same conclusion. Yes, Medicare for all will save money by removing unnecessary paperwork and insurance company profits, lowering drug costs and other factors. These savings will more than offset the cost of improving coverage and expanding it to everyone. The problem is that it reduces the profits of insurance companies, etc., and that's why they're fighting so hard to keep it on. It's more about profit than humanity. We as a people have to start forcing those who represent us to think humanity over the profits of people who are doing nothing but paying a bill. Johnny, come on in. You're hot, Johnny.
Oh, let me shut this. I have the computer on because the airwaves is not working today.
Right.
I think I understand. I think I understood what your previous caller, the female caller, was saying about paying for stuff you're not using. But there's a different way to look at it too. We pay so socialistically for police and fire, and it's like an insurance policy. You don't want your house to burn down. So I don't want to use the fire department, but I would like to know that if, God forbid, something happens and I need help putting a fire out, I can call 911 and the fire department will show up and not put me in bankruptcy court as well as homeless.
Right.
So that's the argument to be made. I agree with the sentiment. I think what she's expressing is that we as Texans pay our fair share of taxes, and we do. But because of our dumbass governor, Republican that he is, he has the power. One man has the power over how many millions of people just in the Houston area alone? What, we have to 4 million, 5 million people now?
Yes.
Imagine that one guy has the power to say, okay, you 4 or 5 million Harris County, Houston people, no, you're not going to have expanded Medicaid. You know, if you're too poor, if you're poor, you deserve to have nothing. That's the message they send.
Johnny, the reason that I, with no hesitation, call every every representative in Austin murderers. And I really don't take that back. I really don't think that is inflammatory. I think murdering means taking the life of somebody else. Okay? And there's some other technical terms that you use for that. Knowingly. Murder, the difference between manslaughter, murder knowingly. I call each one of those folks who do not support the Medicaid expansion to the Affordable Care Act in Texas murderers. And I do not say it to be inflammatory. I say it to be factual. They know that what they're doing is causing the deaths of many Texans, yet they continue to do it. But Johnny, I got to go to Nancy because I only have a few minutes left. So thank you so kindly for calling in, my brother. Nancy, come on in. Nancy, you're on.
Hi. The bill that was presented for Medicare Act of 2023 that was presented Wednesday, I have big complaint about it because it left out two important points that was in a previous bill, HR 676. The good part is that it's from birth, Medicare from birth, and for all residents. That means it includes the undocumented, which of course, you know, disease does not say, may I have your papers? But the bad part was they took out the progressive tax. That means people who make an annual salary over $50 million, that over part, not the under, the over 50 million would be taxed at a higher income tax rate of 13%, something like that. And
right.
Under 50 million would be about 3%. The 99% people would pay 3% more. That was not put in that bill that was presented this week. The other point is a 2-year phase-in. So the older people would get in after waiting 1 year. The others would have to wait 2 years, which is cruel, in my opinion. And I live in a country that had.
Nancy, I got to go, but I want to thank you, first of all, for informing me of that because that I didn't know. But let me just, so I appreciate you bringing that to my attention. But let me tell you, right now, if we have a 2-year ramp up to having a humane healthcare system, because of where we are and where we are likely not going, I will take it. I imagine they did it for fiscal reasons and political reasons. I imagine that's why it was done. We're not in a pure world. We're in a political world. So given that you like most of it, given that Nancy likes most of it, I'll take it. Anything else real quick before I got to go, Nancy? Real quick.
I feel betrayed. I feel betrayed because, without that progressive tax, it's going to be very difficult. It's like
Okay, Nancy, Nancy, let me stop you there for one reason. I want everybody to hear me tell you this for one reason. There is no reason for you to feel betrayed for a substantial step forward. It's a fight that goes on forever. We don't feel betrayed and we don't disengage. What we do is we make marginal changes, we get marginal changes, and after we get marginal changes, we work to make it better. So, Nancy, please keep fighting for what you're fighting for the way you fight. Let's make sure and accept the good that we get and we move on. Do we have an agreement on that, my dear sister?
No, we call our representatives, and there are 8 Democrats that are
Yes.
in the House.
There we go. You just answered the question. Nancy, you just answered it. You stay engaged, right?
Yeah, Lizzie Fletcher and Sylvia Garcia in Houston. They have not ever sponsored Medicare for all. Neither did Beto.
Got to go, Nancy. Thank you for calling, Nancy. I appreciate your call, Nancy. Keep calling, okay? Anyway, folks, look, we got to get out of here. We're almost done with the show, and I need to ask you to call 713-526-5738, extension number 1 to contribute. We need those contributions right now for the program, 713-526-5738. I want to thank Gonzalo for his kind support of the program. Please don't let it just fall on the back of Gonzalo. We need a whole lot more. 713-526-5738, extension number 1 to contribute, or go to kpft.org. Again, that is kpft.org. Hit extension number, or rather, hit the donate button and select the gift that you want, the amount you want to donate, as well as make sure to tell them it is for Politics Done Right. Let it be told that it is for Politics Done Right that you're making your contribution. We cannot do this without your support. We cannot do this without your support. 713-526-5738, extension number 1, or kpft.org. Hit the donate button. Get the t-shirt. It's $100 for the t-shirt. You get the Politics Done Right t-shirt with the logo. You can also, for a $250 contribution, we can go out I'll take you out for coffee, and we can sit down and talk politics, etc., etc. We cannot do this without you. My name is Egberto Willies. This is Politics Done Right, and you guys know how I end this baby. I am what? Out!
OneDrive, again. 3 words familiar to anyone who knows the great programming that you hear on KPFT, because our community, you, keep it alive. That's why Houston's community station is an icon in the most diverse city in the nation. A city with a staggering mix of cultures, opinions, and tastes. And only KPFT Houston can meet those needs. Whether it's music playing only here, human interest stories that stretch the